Hello, everyone. Dr. Christine Smith back for a wonderful interview for you today with Dr. Shawn Tassone, who is a board certified OBGYN and specializes in integrative healthcare for women and has seen over 40,000 women in his time. And he is an MD and also a PhD in mind-body medicine. So it's just a really cool thing to get to talk to somebody with that much things, because we actually met at a conference that was all about learning things like neurolinguistic programming, which is for reprogramming like how we think and how we're showing up in our environment, and that's huge for our health. So I wanted to bring him on today just to talk about all of his experience in holistic and integrative health and women's care. And thanks so much for joining me today, Shawn. It's great to see you.
Thanks for having me.
Absolutely. So, Dr. Tassone, I was just telling everybody a little bit about you and just about your history. I know you've seen over 40,000 women in your time of being a practitioner, and I'm just so curious to hear a little bit more about how you fell in love with this niche of women's hormones, because I know you've even written a book about it called The Hormone Balance Bible. So, yeah, I'd love to just, if you could tell us a little bit about yourself.
Well, I'm pretty boring, actually. When I was a second year resident, my mom was diagnosed with, well, actually, when I was in residency, she was diagnosed with ovarian cancer. And at the time, I knew a lot about ovarian cancer. Obviously, I was learning about it. I knew about the surgeries and the chemotherapy. What I didn't know, and what I discovered over the 5-year journey that she had, and eventually she succumbed to the disease, was that while I knew a lot about it and I knew about the medicines, she suffered a lot. And I couldn't help my own mom feel good. I couldn't help her, the joint pain and the hormones. They wouldn't give her any hormones. I felt worthless, and I felt, gosh, I'm a women's healthcare doctor. I can't even help my own mom. And so I kind of went on this journey that led me through the integrative medicine program at the University of Arizona. And then I did a 6-year PhD in philosophy because I just needed more. I just needed something. And that took me to South America, where I learned different methods of healings from different indigenous peoples, and just kind of came back home and was starting to read a lot of Caroline Myss, archetypes and Jung and all that stuff. And just kind of, it all just sort of conglomerated into this book where 15 years ago, Suzanne Summers wrote Sexy Years, where she broke the mold on bioidentical hormones. And she put me in that book as a resource. And so for the last 15 years, I've had that recognition. So I combined the hormonal aspect with all this other learning that I'd done. And that's where I came up with the Hormone Balance Bible and kind of where I'm at right now.
Wow, that's an amazing story. Thank you for sharing that. And I think all practitioners at some point have a challenge that they go through that inspires them to do what they do. So nothing more inspiring than going through a journey with family. So I'm glad that you have become the practitioner that you are now after experiencing things like that. And I'm sure in the Hormone Balance Bible, you address a variety of things around holistic medicine. What do you think, what can you give us a little summary of kind of what is covered in there and how you really like to teach people about their hormones?
What I noticed was, when I would talk to a woman, say, about testosterone deficiency, they would get it and they would understand, but there wasn't this connection. I just wasn't feeling a connection. But if I talked to them in a story, like I always would joke, like, oh, you don't have a great sex drive. Well, neither do nuns, you know? And so I would start telling these stories about nuns, and people were totally connecting, like, oh my God, I'm a nun or whatever. And so I came up with the archetypes because stories connect with people. I think narrative medicine is a real connection piece for a lot of folks. And when I would tell these stories, they were just like light bulbs and connections. And it was so much easier than talking about the lab values and stuff. But I still do that, but I incorporate these stories. So my book, The Hormone Balance Bible, are the 12 most common hormone imbalances that I see in women. associated with a storyline like the nun, the queen, the overachiever, stuff like that. And then when you discover, when you write a book, it's a formula. You have to state a problem and then you have to solve the problem. So the solving of the problem is what I call my Shines protocol, and you got to have a real cool, fancy acronym, obviously, when you write a book. So the Shines protocol is for each of these 12 imbalances, I have a 6-step process, spiritual practice, which may sound kind of weird, but it could just be something like journaling or going out and outside in nature. Hormones is the H, which I do. The I is infoceuticals, and infoceuticals, i.e., a friend of ours, Harry Massey, who kind of coined that term. But what I look at that being is the informative part, energetic piece of medicine. I call it my 20% woo factor. That things you might want to try that I don't proclaim to understand, but there are other things you could do. The N is nutrition. The E is exercise, and the final S is supplementation. So I give all 6 of those in each of the 12 archetypes. So you can pick and choose. Only one of those 6 steps do you actually need a physician for. That's the hormone piece, but you don't need me for the other 5 things that you can try on your own.
I love that because I think one of the things that's happened to our healthcare system is it has transformed into people kind of feel like a victim and like they have to reach outside themselves to heal. And so much healing is done at home, whereas the role of the physician is more to be a guide and help with like the missing pieces. So I think that's a wonderful approach. I love
Well,
that. And I know,
the allopathic model we have right now, you have an active physician and a passive patient. And I think, like you said, we need to flip that where we have the active patient and the passive physician. Like you said, I kind of view my role as being when you're learning how to bowl and you go bowling and they have the bumpers in the lanes. I'm kind of the bumpers. Like I don't want you to go in the gutters, but you can play around with stuff in between and find things that work for you.
that's such a healthier mindset of exactly what you said. Play around with things, and I like to work the same way with people. I think a lot of people have been put on like super restrictive diets, which sometimes we need, but can be tough long term. And so I encourage people, I'm like, hey, like try this thing out, like see how it goes. Listen to your body, and I think you're kind of along the same lines of really just teaching people to listen to their body and understand what's going on. And I know you mentioned a bunch of different hormone imbalances in the book. I'd love if you could comment on, any of them that you want to list. I know you had talked about kind of like there's top 3 that you tend to
Yeah.
see. And then wherever you want to put it in there, the rising concern that people have around hormone replacement therapy safety and when it's appropriate versus maybe when you might want to try something else first and use that later.
So the top 3 imbalances easily. Number 1 is testosterone deficiency, the nun. I see it across all age groups. Mostly occurs in young women because of birth control pills, because birth control pills lower testosterone levels. Number 2 would be estrogen dominance. So you have too much estrogen in your body, and that can be even compounded more by a low amount of progesterone. The estrogen dominant person is usually, I call them queens, because the quintessential female hormone is estrogen, and the highest ranking woman I could think of would be a queen. And you could be an off with your head type queen. You could be a benevolent queen. So there's different storylines in there. And then the third most common one is pretty much a toss up between low progesterone, which is the unbalanced heroine, or the underdog, which is kind of low thyroid. Low functioning thyroid is really, really common. And the sad thing is, when people draw labs, doctors, they'll look at the lab values and they'll say everything's normal. The problem is you could be at the bottom of normal and not feel very good. You could have every symptom of hypothyroidism, but technically be in the normal range, but you're at the basement of normal. And I think doctors are sort of failing in that aspect. They just look at the number, they don't look at the symptoms.
Yeah, absolutely. And you had mentioned in there thyroid even, and I think of the thyroid as kind of the sentinel of the body. So to me, if there's something off with the thyroid, I'm usually looking for some kind of infection or toxic exposure or overburdened the body in some way. What are your thoughts on things like that around, if someone is dealing with depleted hormones, do you like to check different systems first, or is there a time when you generally go to hormone replacement therapy first, or what are your thoughts?
Well, if it's a woman in menopause, I probably would go to hormones first, because they don't have any and they probably can't make any. Perimenopause is a little trickier because there are, like you said, multitudes of systems from the gut to looking at other toxins. Sleep is a big one. Weight, it can be an issue, which is obviously related to nutrition and exercise sometimes. And then it's a chicken and egg thing, which came first. So sometimes it's hard to get to that root cause. But the other thing with integrative medicine that I've tried to do, because I'm not an expert in everything, like say mold exposure, it's just not my expertise. So I have a team of people that I'll refer to if I'm concerned that where I would want her to be. So yeah, you have to have a good referral source as well, is because nobody's obviously, and that's why I think some people that pretend they're these one man, one woman shows where they can do it all. I don't see how you could possibly be good at everything.
Yeah.
And as
No.
far as the hormone safety you asked about, I just did a podcast a couple weeks ago on this new study that came out that studied women after the age of 65 that were on hormone replacement therapy. And what they found was that women over the age of 65 had decreased rates of breast, colon, and lung cancer, decreased rates of dementia, and a survival rate of 20% higher than women that didn't use estrogen. So I think that's pretty much the nail in the coffin of this myth that estrogen causes breast cancer. Tried for years to demythicize the whole aspect of the Women's Health Initiative, which really ruined an entire generation of women and doctors because it scared the hell out of everybody that estrogen was this horrible thing. And the reality is that study was just awful. We know it was awful, and it just did a lot of damage that hopefully we're starting to reverse the storyline now.
Okay. Well, thank you. That is a very helpful way to think about it for people. And, I think it is variable for every single case. So, for anyone listening, as we're talking about this is all educational. Please
Yep.
ask your practitioner what is right for you. And there are a variety of ways that you can be tracking that. But one of the things I'm a big fan of is if anybody is doing any kind of HRT, should be doing follow-up labs pretty regularly to be checking the levels and making sure that what you think is happening in the body, and checking the conversion of hormones back and forth, because our bodies are incredible machines and they have this ability to transfer molecules, but we also have to make sure that they're going down the pathways that we think they're going down. But I do think you're right. I think it can be helpful in a lot of ways. One of the other things I'll look out for if anybody is doing this is I'll just keep an eye on blood clotting. And like there's a lab test I like called a D-dimer, and anyone who's on any kind of replacement, I just kind of keep an eye on that to make sure, again, that the body is responding in the way that we expect, because there's a variety of concerns around hormones. And Dr. Tassone, feel free to correct me or add any thoughts here, but there's a variety of effects that hormones can have on the body, many of them very positive, and some of them just things like it affects, how our blood moves and affects how our brain functions and how our stresses. That's usually if you're on the lower side. But I've known a couple clients who were put on a level of testosterone and all of a sudden their entire personality kind of shifted. So just knowing these things and knowing what you can look out for and what you can ask your physician about, I think is the key to having this all happen in a harmonious way. But yeah, please add any thoughts to that one as well.
Well, we know topical testosterone, or topical estrogen does not increase the risk of blood clots. So when I do give estradiol, I try to give it topically so we don't have that increased risk. The problem with hormones too is that while low amounts can be symptomatic, the other end of the spectrum is that there's a lot of practitioners out there somehow or some reason they're overdosing women as well with this concept that, well, if a little is good, a lot must be better. I'm seeing this particular subset of women in the state of Minnesota that are seeing this one particular provider, and they are literally being overdosed with estrogen, progesterone, and testosterone. The levels I'm seeing are just insanely high. Like a normal estrogen would probably be 60 to 80 or 100, and they're like 900. I mean, so like you said, you may not feel that. Some women don't feel it, but it will catch up with you eventually. And women that are on hormone pellets, which I'm adamantly opposed to, have testosterone levels that are many times at the level of a man's, and they feel great. Why wouldn't you? But over time, that will catch up with you. Just like any other medication, you take, 20 Motrin a day, you're going to feel fine for a week or two, but it's going to catch up with you eventually. So you want to make sure that you're not being overdosed as well.
Yeah, absolutely. It's definitely one of those Goldilocks things. It's got to be exactly the right level, and that can kind of vary from person to person as well.
Yeah.
And I had a couple of questions come in, so I thought these were some good ones to address. One person said, like, what's the role of doctors in keeping up with current studies and renewing degrees, and what's your opinion of this, of where the ball might be being dropped? And, I think doctors like Dr. Tassone, like he was just listing a variety of studies, and I try to review studies as well. So I think a lot of them out there are trying to review the current literature regularly. In order to renew degrees, we are required to have a certain level of continuing education credits every year. So in order to maintain your license, you have to do continuing education. Some doctors do more than others. I know I have never had a problem meeting my continuing education hours because I love seminars. I'm always learning. So it just varies, but that is a responsibility. And Dr. Tassone, any comments you want to add?
Well, for the American College of OBGYN, you have to you have to answer 120 questions a year that are based on recent articles that came out that year. 4 questions, usually 4 to 8 questions per article. You can pick, first of all, they pick which articles they think are important. So whether or not they're choosing hormonally related articles is one. And then second, there's so many topics in that. You got obstetrics, you got high risk obstetrics, you got office gynecology, you got surgical gynecology, you've got urogynecology, and there's so many aspect areas that if there is a hormone article, a physician may not even choose to read that article. They might choose a different one. So doctors will choose the topics that they're interested in. And that's the other thing. If you're so busy as an OBGYN because you're seeing 55 patients a day and you've got to keep up with obstetrical stuff as well, it's hard sometimes to learn all of the ins and outs with these articles. I mean, because I do hormones, that's why I can focus on that. But if you asked me the most recent data on deliveries and C-sections, I may not have that off the top of my head because I haven't done a delivery for 8 years. So, you have to just find the people that have a certain area of expertise and what we like.
Absolutely. I couldn't agree more. There was another question that came in, and someone asked, is it ever too late to take hormone replacement after the onset of menopause?
The thought process currently is if you haven't been on, and it's usually the estrogen piece, not the other hormones. If you haven't been on estrogen for more than 10 years, or you're over the age of 63, what they found was women that were started on estrogen therapy that were outside of those 2 criteria and had calcifications in their coronary artery vessels did have a softening effect of those calcifications with the estrogen that could potentially break off and cause a heart attack. So there was a slight risk of heart disease and heart attack in starting a woman after 10 years of menopause on estrogen. However, there are also heart protective effects of estrogen. There's dementia protective effects. There's bone protective effects. What I will usually do if it's a woman over 63 that wants to start, I usually will recommend they go get a calcium CT score of their coronary vessels. It's like about $95. It's a 10-minute test. And if they have a lot of calcifications, I might counsel them against it. just because I don't want to increase the risk of heart disease. And usually I can work with other hormones like testosterone. If they're having hot flashes, it can help. Testosterone will help with bones. So I can definitely help in other avenues. But if they have no calcifications on a CT, then usually I will start them on a low dose of estrogen.
Great. Thank you. That's very helpful. And as we're talking about all of these, like I know you've mentioned a couple different age ranges. What are the groups of women most affected by hormonal issues, or kind of what have you seen in various age groups of what they tend to be dealing with, or how it can kind of cascade later? Because I know, it's a significant trend to be on hormonal birth control, but that can really affect things later in life. So I'm
Yeah.
just curious as your experience.
So the younger age group, your adolescents probably through age 25, deal mostly with irregular periods, PCOS, polycystic ovarian syndrome, maybe an occasional thyroid issue. Women in that 25 to 35 age group dealing more with probably, again, some cyclical irregularities. You're starting to see more insomnia, some more thyroid issues, low testosterone because they've had kids, they're not sleeping good. They just are getting more run down. Their cortisol levels might be tanking at this point because of that constant hamster wheel effect. Women in that 35 to 50 range, that perimenopausal range, that's when you start seeing more issues definitely with sleep, weight disturbances, with insulin resistance, um, negative side effects from like birth control pills, prolonged exposure to that. Again, polycystic ovarian syndrome at times. Thyroid tends to be a little bit more involved at that point. And then once you hit 50, the average age of menopause being 51, that's when you start seeing more of the hot flashes, the night sweats. You start seeing more of the weight gain. Most women in that 45 to 55 will say they've had that 10 to 15 pounds of fat around the middle, that no matter what they do, they're having a hard time getting rid of that. That's really a common complaint.
Okay. With all of this, if there were women really wanting to balance their hormones and work on it naturally, maybe before considering HRT, what are some of the other alternatives that people can check out that you really like using?
Well, one of the things I use a lot of is maca, which is a root plant from Peru, and I'm sure you've heard of feminescence. I have been promoting that for probably 8 years. I do find that it does help a lot, with the symptoms for sure. It may not necessarily shift the numbers on the labs a whole lot, but it does help a lot with the symptoms. And the great thing about maca is there's different strains of maca, there's different colors, types, it depends on where they grow. And the Feminescence, the company that makes that symphony, is really good at having different products for different age groups and for even for men. So that's the thing, is when women are using like a maca powder, it's hard to know exactly what's in the powder because I wasn't there when they made it, but I like companies that just use pure products. Obviously, maintaining a healthy body weight is super important. Exercising and eating right, good fats, low processed foods. Um, and I think, occasionally we tend to negate the effects of vitamin D in medicine for sure. I think they think we overtreat it, but the reality is vitamin D is super important. Obviously, it's a hormone in and of itself. It's a prohormone, so definitely important to look at.
Hugely. And it interplays with estrogen for bone density and a whole bunch of other things.
Yeah.
Mood. Yep, absolutely. In all of this, if there was like a big myth about hormones that you wanted to bust for people, or just something you really wanted them to know, what would that be?
We kind of touched on it, but the biggest thing I constantly am getting rid of is this concept that estrogen causes breast cancer. If estrogen causes breast cancer, then every woman in the world will get breast cancer because you all have estrogen. Estrogen, if you have a breast cancer cell in your body, will stimulate that breast cancer cell, but it may not be the cause. Cancer is a multifaceted approach. 4-methoxyestrone, which is a metabolite of estradiol and estrone, is considered a carcinogen, so it can increase the risks if you have that family history, if you have that conversion you were talking about earlier that you can look at with metabolites, but very rarely, and we know through the studies that are coming out that estradiol in and of itself is not causing breast cancer. Even in the Women's Health Initiative, that horrible study, the Premarin only arm, which is that horrible equine urine that we used to use for hormones, didn't have an increased risk of breast cancer. It was the combo of estrogen with the medroxyprogesterone, that's a fake progesterone, that had the increased risk. The estrogen only arm didn't have any risks at all. So that I think that if I could dispel that estrogen causes breast cancer, that would be the number one thing.
I like that. And, I think I try to remind people a lot that it has a lot more to do with your ability to properly detox your hormones. And I think that is something that I always really like looking at with people is metabolites and helping them to understand how their body is actually processing their hormones through the whole pathway. Because I think that is one of the things that gets missed. I'll see a lot of people do blood tests for hormones, but then they're not checking the pathways. And so with that, I think that's just one of the things that is really important to look at. And that can be done through like a urinary test or sometimes doing saliva tests to really also check on the adrenals. I think the adrenals get forgotten about a lot in hormones as well. So I think that's a good thing for people to know and just consider. So with all of this, are there any other things that you'd like to add or just concepts around holistic care? I know you had mentioned like the little bit of a spiritual journey that can be tied into all this. And I think that is the true understanding of holistic care, is realizing that we also have this kind of energetic body that contributes to our physical body. But just, any last thoughts around integrative holistic care?
I think the other thing is mainly most women will experience gaslighting in the medical community. The spiritual practice is trying to not respond to that per se. Keep searching, keep pushing, and finding the people that you want, and realizing that women are changing this kind of paradigm currently with their feet, and they're walking, and they're seeking out providers, and it is getting noticed by the medical community. Unfortunately, my fellows are responding with anger. They're mad because of all these alternative healthcare practitioners that are sucking the patients away, but the patients wouldn't be going there if we were doing our jobs. And that's the reality of it. We are failing as OBGYNs because we're not meeting the patients where they are. So you can try to educate, you can try to know what you want. I think if you go in knowing what you want, what labs you want, why you want them, and then if they say they don't want to, I've always said you can't change a doctor's mind. You're not going to do it. But you can walk out and just find somebody else. And eventually, what is thought of as heresy in medicine 10 years later is considered standard of care sometimes. So you have to just know what's right for you and find somebody that understands what you're going through, and know that as time goes on that things are changing.
Absolutely. Thank you for all of that and for educating yourself beyond average and really understanding the holistic and integrative approach to care. I think it's the future of healthcare and the evolution of medicine into really true holistic care. If women wanted to work with you or like find out more about you just as they are on this search for the right provider, where would you send them?
Well, they can click on the link, my name here on Instagram. I'm on there every day talking about stuff. The other thing is you can call the office at 512-956-0296. I'm licensed in 25 states right now, so I can see a lot of women. The second post on my Instagram page, the pinned post, is where all the states are that I'm licensed. And really, you can start with my book. If you want to learn more about your archetype, you can go to tassonemd.com/quiz. It's free, obviously, and you can find it. It's just a good place to start.
Beautiful. Thank you. And, if I was going to end with anything, I know one of the things I learned from spending time with you is that you have an awesome sense of humor. Are there any last jokes you'd like to crack about being a male OBGYN?
It's an interesting space to be in as a male. I am kind of a funny person, and you have to You have to tailor that sometimes because you don't want to be inappropriate with your humor. But I do have a video out there about the 5 things I've removed from vaginas that are rather interesting. That I think if you want to laugh, you could go watch that. And I also do some stand-up comedy because I have to have an outlet. So it's an interesting thing, but it's usually the best of times. The good news is with women's health, there isn't a whole lot of negative. There is cancer every once in a while, but it's pretty rare and it's mostly an uplifting. And I really just have enjoyed helping women. I mean, it's really fun to know that. It's so weird because what I'm doing isn't rocket science. I'm just replacing what isn't there, but my colleagues won't do it. And so, job security for me, but I love it when people think I'm really smart, but the reality is I'm pretty average and I just replace what's wrong. So, um, yeah, I don't know. But go watch the video about the 5 things I've removed from vaginas.
I'm
It's pretty good.
I'm gonna go with I don't think you're quite average from after our time together,
Well,
but
maybe in
I think
different ways, yeah.
no, I love like you're one of the few that I've met that really does have like an integrative holistic mind around things. So thank you for that. And thank you for taking the time to do
Sure.
this today. And for anyone listening, definitely go check out everything. Someone just commented that they love your podcast. And what was the name?
I have a son who's a redhead, and my grandma was a redhead, so maybe there's something in there. I don't know.
Beautiful. And if anyone wanted to check out your podcast, what's the title of it?
Confessions of a Male Gynecologist.
Perfect. All right. Well, thank you so much for the time today. And anyone who wants to reach out, send him a message, send me a message. If you guys liked this and you want us to do another one and comment on some more advanced topics, feel free to comment below. Please share it with anybody that could benefit. Every time you share, you're helping out small business. So we appreciate you. Thanks for being here.
Thank you.
And thank you so much, Dr. Tassone.
Take care.